Why is an endoscopy used for esophageal varices? Imagine a tiny camera traveling down your throat to take a close-up look at your esophagus. That's what an endoscopy does. It's a key tool used to find and manage esophageal varices, which are enlarged veins in the esophagus. These veins often develop because of high blood pressure in the portal vein system, a condition called portal hypertension. Portal hypertension usually happens when the liver is scarred or damaged, as in cirrhosis. When the liver tissue becomes stiff and scarred, blood flow through the liver slows down, causing pressure to build up in the portal vein. This increased pressure causes veins in the esophagus to enlarge, forming varices. These varices can be dangerous because they might burst and cause severe bleeding, which can be life-threatening. Using an endoscopy allows doctors to see inside the esophagus directly. They insert a flexible tube with a tiny camera through the mouth and into the esophagus, stomach, and upper part of the small intestine. This lets them check for the presence of varices, measure how big they are, and look for signs that they might bleed soon. For example, red streaks or spots on the veins are warning signs that the risk of bleeding is higher. Detecting these early is very important because it helps prevent serious bleeding episodes. In patients with liver disease, especially cirrhosis, regular endoscopies are often recommended. Since cirrhosis causes scarring that impairs blood flow, these patients are at a higher risk for developing varices. If doctors find varices early, they can take steps to prevent bleeding. During the same endoscopy, they can also perform treatments to reduce the risk of bleeding. One common treatment is endoscopic variceal ligation, where small rubber bands are placed around the enlarged veins to cut off blood flow and prevent rupture. This procedure is quick, safe, and highly effective. Endoscopy is not just for diagnosis. It also plays a vital role in treatment. If a patient is already bleeding from varices, an endoscopy can be used to control the bleeding immediately. It is considered the preferred method because it is safer and more effective than older treatments like injecting chemicals into the veins. Plus, doctors can repeat endoscopies over time to monitor the varices and adjust treatment plans as needed. In summary, endoscopy is used for esophageal varices because it allows doctors to see the veins directly, assess their size and risk, and perform treatments to prevent or stop bleeding. It is a crucial part of managing complications related to liver disease and portal hypertension. Regular monitoring and timely intervention through endoscopy can save lives and help maintain better liver health. Always remember to consult healthcare professionals for personalized advice and treatment options.